The 8-plate technique of guided growth is a minimally invasive outpatient procedure which provides optimal results when the periosteum is left undisturbed to prevent permanent closure, and screw placement across the physis or penetration of the articular surface is avoided. With use of the pre-contoured 8-plate and 4.5 millimeter screws, hardware failure is extremely rare. Post-operatively, the patient should be monitored at 3-month intervals to observe and document improvement. Correction of most deformities occurs within 6 to 18 months, at which time the implant should be removed. Step 1. Using the C-arm, hold the 8-plate centered over the physis. Localize the physis fluoroscopically and mark a 2 to 3 centimeter incision. Incise the skin and divide the deep fascia, taking care to preserve the periosteum. Insert the guide wire, which can be a K-wire or Keith needle, a few millimeters into the physis. Step 2. Using the center hole, slide the 8-plate over the guide wire. The 8-plate should be centered upon the physis and the position confirmed with the fluoroscope. Step 3. Using the drill guide, first insert the epiphyseal guide wire, followed by the metaphyseal guide wire. It is not necessary for these two guides to be parallel. It is more important to avoid the physis. Remove the center guide wire. Step 4. Drill using the drill guide and the step cannulated drill bit to a depth of 5 millimeters. First drill the epiphyseal hole, followed by the diaphyseal. Insert 2 cannulated self-tapping screws. Note the position of the screw proximal and distal to the physis. Screws do not need to be parallel. Remove the guide wires. Post-operative. It is not necessary to apply a cast or a splint. Immediate weight bearing is encouraged with crutches as needed for comfort. Post-operatively, when the legs are straight, the graph shows correction of the deformity, the plate is removed. Depending on the diagnosis, there is potential for recurrent deformity. Hence, the patient should be monitored periodically until skeletal maturity is reached. If the deformity reoccurs, the procedure may be safely repeated.